Hi, I'm Aruna.
And I'm Shankar.
We're desperate parents. We have a high schooler at home who doesn't know what career choice he should make. And like all teenagers, he communicates only in grunts and shrugs. So we decided we'll have to do the talking. In this podcast series, we'll interview experts from various fields and ask them questions that takes you into their life, gives you a sense of what their work is really like and how their field is developing.
So, one week we could be speaking with someone who teaches aerospace engineering, the next week with a practicing lawyer, and the third with the head of a research lab. And we plan to go beyond these conventional career choices. For example, who wouldn't want to hear the life story of the chef at a five-star restaurant, how he got where he got, for example?
And along the way, we'll also share a nugget or two about decision making, maybe a tool or a mental model that helps while making any choice. We hope this will be useful.
Okay, the guest on today's show is Dr. Swami Murugappan, MD, PhD, who's joining us from California. Dr. Swami is a hematologist oncologist. Hematologists, as you know, focus on blood, bone marrow, and lymphatic disorders. Oncologists are cancer specialists. So, in this area of specialization, Dr. Swami focuses on hematological cancers, and much of his work is around developing transformational care therapies for cancer patients. He's worked with several companies in product leadership and has been consulting as chief medical officer with other companies. In addition to purely medical work, Dr. Swami is also heavily focused on technology. He's the founder and CEO of an artificial intelligence machine learning stealth technology company that is developing tech solutions to accelerate drug development. And of course, Dr. Swami is currently an artificial intelligence business fellow at Perplexity AI. Dr. Swami, welcome to the show.
Thank you. Happy to be here.
Nice to have you. I'll kick this off with a question on your story. Can you tell us a little bit about how you got where you got, including what you studied? How did you get into the medical profession, and how did you end up specializing in what you're specializing in?
Sure. So, I'll start by saying that, where I am today, was not something that I had exactly planned when I was in high school, and that's completely okay. So I grew up doing my high school in the late 80s. And, the way things used to be, at least in my household, my father had a dream that, his kids should be either engineers or doctors. Those are the two broad professional areas, where it was thought to be like a stable career with prospects for a job and stuff like that. So it so happened my brother and sisters became engineers. And so the third option that was left for me to seriously consider from my dad's standpoint was to become a doctor. And the way I had positioned my high school curriculum was to have a shot at both. The one criteria I had in my mind was to pursue a professional degree while still being in Chennai. That's where I grew up. So it so happened that I got into both. I initially started with, for about 4 months in the College of Engineering at Anna University. So I did start my engineering school first. It so happened in my year, the medical school admissions were delayed through the All India entrance exams that used to be conducted then. And eventually I got into Madras Medical College through my counseling. So I actually switched after about 4 months in an engineering school. The key thing that I realized during in medical school, and this is an important thing for, that I tell my kids, is sometimes you start a journey and then, it helps you reveal yourself in ways that you hadn't really thought, how you would be. So I went into med school in Madras. Great experience, great school. Landed up realizing that I was more keen about learning how certain things happen and why they happen. So in this case, particularly around why we get certain diseases and how exactly to treat. So the understanding of it became more important than, to some extent, the practical aspects of being in the clinic and practicing. So that drove my decision to really pursue a path that some of my friends at the time and previously through my alumni I had done, which is to go pursue a research path, like, in the US. So that's what I did. I finished my MBBS and then quickly pivoted to pursuing a PhD in Philadelphia in the US. So then my focus was, again, basic biology. I was studying platelets, which is one of the cells in the blood that helps you clot and prevent bleeding from happening. And I had two options after that, either to continue just being a researcher or go back to clinical medicine. I was fundamentally motivated at the core, and this is something that drove all my decisions, like, even today, is like, figuring out a way to help patients, like, and either through research or being in the clinic or doing other things, but it has to, navigate towards that one fundamental, meaning for me, like, when I think about my career. So I did some clinical rotations during my PhD in the School of Medicine that I was in. The area of research I was focusing could have been applicable to either cardiology, or I could have gone into the hematology and the oncology space. And quickly I realized that oncology, and I'm sure, like, this is something that we all share, we hardly understand the biology of cancers. We don't know why it happens, and how well to treat them. So I saw a lot of opportunity to do additional research, which also lined up with, like, how fundamentally, like, I'm a very curious person. Like, I need to know why certain things happen and figuring things out. So I then decided to go into the hematology oncology space, which required me to go back into clinical medicine through doing the licensing exams, doing an internal medicine residency, which is required as part of the training, which is very similar to the MD general medicine people do back in India. And then I specialized in oncology at the University of Washington in Seattle to become a hematology fellowship, hematology oncology. So I'm double boarded in both the specialties. So that's kind of where I landed up as an oncologist.
Okay.
Mm-hmm. So as you know, we're desperate parents trying to find answers to help high school students make decisions. You talked about some of the reasons that drove you, the purpose about patients and having curiosity. What do you think are the important reasons why a high schooler should choose medicine? Is making money one of them? What decision-making process should a high school student go through before deciding on the medical profession?
Yeah, that's a great question. And the answer might differ depending on, like, what stage you are in, right? So if I go back to my decision to pursue medicine, and having done that now and being out for almost like 25, 30 years now, so I think the core principle has always been, how do you help people? And there are a lot of different ways to do it, right? It's not like that you need to be having an MBBS tag or an MD tag to do that. But there has to be that real drive to spend your career that helps, like, patients. And what I've realized serendipitously is, becoming a doctor or doing a medicine track is a very powerful way to do it, and it really helps you be the architect of how you find out what's wrong with someone, and figuring out how to treat. And a lot of times it's not very clear as to what the best treatment is. So you need to be very comfortable with uncertainty and making some compelling decisions that can impact someone's life, based on not the full set of data, and still you have to make that call, right? So, so as you think about how you want to spend your time in the day, and I think you need to have that burning desire to do something the best you can for patients. So helping sick patients, or it's one of what should be one of the main reason. I mean, there are a lot of mindsets and skills, like, that are required to facilitate it, and that's an evaluation that everyone has to do, whether that's what, like, they want to do. Having said that, I personally think money is extremely important. I mean, I don't think anyone would contest it in the world that we live in right now. And my opinion, medicine is almost like a guaranteed sure shot of way to like make that money. How much you make, in what capacity you do that. I mean, those are all very personal decisions, and sometimes those things evolve as time goes on. But I can tell you, like at least in the US, once you do your MD degree, like there is almost like a guaranteed financial security, and it's not like you're going to start off with $50,000, $60,000 a year, like typically depending on where the job is. It's a good start, and but again, there is a lot of work that goes into like getting to that stage. So if money is the only driver, and inherently, like you're not motivated to, either you don't want to put that kind of time and effort into a career, or you don't have a burning desire to, or a purpose to help patients, then this is probably not the best way to make money. There are obviously like other ways you could probably do that. So it has to really come from that core desire to like help patients in whatever shape or form. There are a lot of different ways you can do that, but medicine is a very powerful way. Being a doctor is a very powerful way to do that, and to make money too. That's what I do, and I'm quite happy about it.
So I just pick up on that. I mean, it's interesting that you say that. One concern that students have, obviously, especially those who go to the US, is that it takes forever to start making money. They study and they study and they study. So what's your advice to them? How do they plan this financially? I mean, how to keep going?
So I think there are two ways to think about this. So if you have decided to become, going to the medicine track, and particularly if you're from India, like there are two options, right? One, either you do the next steps back in India, or you step outside the country to one of the other, classical groups of countries that, I know people go to, like either to be, in Europe, predominantly in the UK, or most of them come to the US. It is a long path, but what I would say is if it's planned well, it's actually like shorter than what some of the kids go through here who pursue high school and college here, right? Because here kids finish high school, they go to the mandatory 4-year college, and invariably most of them don't get into like med school right away. So that there is usually like a gap year where they are trying to get additional experiences. And then they go to med school, which is again 4 years before they get into residency, where you see any dollar at all, right? During residency, you do get paid. I mean, you're not getting paid a lot, but you get paid enough to have that life that you can sustain. What I would say for high schoolers back in India is, if you plan well during your med school, where you want to go to a particular country, you just have to make sure like you get onto that track right away. Meaning, you finish med school. Some of my friends from MMC and even others that I met here, they finished high school and then they got a residency right away. So they are actually like starting residency like at age 22 or 23, depending on when you started your medicine, compared to say a kid here, like who typically starts around like 28. And then if you want to specialize, it takes another 3 years. So from end of med school to starting a job, which is a well-paying job, like you should plan for at least like 6-7 years, which is long compared to, say, for example, what my brother did. I mean, he finished high school, went to IIT Madras, finished, went to a job, did an MBA, and then he was way ahead of like when I started, starting to see like any income, right? So there is going to be always that difference. And this is where, again, it comes to the core purpose, like why you became a physician in the first place. So it's that compromise, which is not, we're not talking about decades of compromise here. I would say, a 5-6 years difference, but the catch up is pretty fast compared to like a entry level engineering graduate, which means you may know more about like what kind of money people make when you finish an engineering and a master's and get a job in a company. But I know when I finished my training, some of the offers I had like were substantially like more than like $200,000, which you quickly catch up to financially, like the delta. But you have to put that time. So it's all about planning. So during that if I would do it, if I did redo it, I mean, I finished my MBBS and did a PhD for like five years, and then I went into residency. So there was a longer way, but that was my personal decision based on my interest, what I wanted to do. But if you want to go straight up into clinical training, I know a lot of kids like from MMC went straight after finishing their 1 year CRRI training into residency, and they were off well hired off when I started. So I think it's okay. Again, it depends on what's driving you to do that. If you came in to quickly get to a job and make money, that's this is it may disappoint you. And also how much work and how hard the journey becomes to get there. So that's what I would say.
Mm-hmm. So speaking of your career also, and while looking at medical as a profession, today it's not just being a doctor, right? There are so many opportunities: computational biology, biotechnology, hospital management, so many related fields that you could go into. And you've done many of those. So could you take our audience through what the top options might be if you choose the medical profession and perhaps you're not oriented towards becoming a practicing doctor?
Yeah, that's a great point. I would say unlike when I finished MBBS and thinking about options, there was only certain conventional tracks, right? And even in the US, even now the conventional track is you continue remaining a practicing doctor. You're in the clinic seeing patients every day. Or if you're in the academic university setting, you practice, but then you also get to do some research, or you want to teach, right? Or you do all three of them together. That I would say is still 70-80% of what at least the physicians do who are training in the US. That's a traditional track, and that's totally okay if you want to be with patients every day, all day. And I think that's a great option. But right now, the opportunities have evolved in a way where there is a lot of realization as to how and what you learn during med school, and the way you're taught to think about the human body and the disease and stuff like that could be so powerfully used to enhance additional disciplines. So I would say some of the other very popular areas that physicians have gone over is they've gone to become chief medical officers for hospital systems, which is you have to manage a big system. You probably have your own clinic for some part of the day, but then you're running a business organization, right? But again, the business purpose is to help patients, so it still remains core to what you want to do, but you're now doing something quite different. And then the second scenario is what I do for majority of the work is, I don't practice. I have a license. If I want to practice, I can go back. But I made the conscious decision to kind of remain core to, I need to do something to help patients, but it also needs to be something that satisfies my passion for curiosity and understanding. So I went into all in research and how do we develop medicines to treat some of the cancer patients. And so I'm on the biotech pharma side of things. It's a different environment. It's a for-profit based, more regulated environment. So it comes up with its own unique challenges. But then you see the business aspects of it. There's a lot of other disciplines that you interact with that makes it quite interesting for me. I've seen some of my colleagues go completely, into law. So they have an MD and a JD or an equivalent law degree, where now they're focusing on how do you protect technologies and IPs, corporate law as it relates to pharmaceuticals. So that's one track, and a lot of universities here facilitate that. They may have joint MD JD programs, or even residency. You can combine that with the JD. Same thing for MBA. There are a lot of MD MBAs where they either go again into management roles, either in the hospital setting or in the biotech pharma, or it could be completely different, where they may be doing more venture capital investment guidance, private equity and things like that. So, I get, as part of biotech role, like I get involved with a lot of the venture capitalist companies, and I've had interactions with doctors, who seem to thrive there, where they are using all the knowledge that they gain from medicine, but they are so good at the financial aspects, or the business considerations, how to build a company. So you may have a single purpose, that drove you into medicine, but you may have some really unique additional talents. And I am a strong proponent of not, forcing yourself to be on one track, but having an interdisciplinary approach to how we want to, because it opens up a lot of opportunities otherwise. But I would say the powerful thing in any of those combinations is fundamentally that you are a physician, right? I think that's where it comes from. The ability to be a doctor, understand how treatments are given, and understanding the biology, that kind of forms the core. If I didn't have it, it limits some of these parallel opportunities that that I did have as I was thinking through my career.
You mentioned earlier that the driving force behind this career is essentially the desire to help patients to get to the bottom of what afflicts them. If you can narrow that down a little bit, what are the essential skills needed? I mean, again, you mentioned answer the last question. It looks as if it's fairly wide-ranging. So if you can tell us what, if I were an aspirant to
Sure.
these fields, what I would need to have in my skill set and mindset.
Yeah, so I mean that's a very important question, and a lot of times once you start the journey is when you realize whether you have the mindset or the skill, and it's completely normal and okay to adapt at the time, and you should, right? It's too much to expect in a high school person to to really map out all those things on top of the stress that they are already in, right? So it's kind of unfortunate that they have to make some decisions like that early. But I think the key message I would give them is you can pivot at any time, right? Whether you're a physician already and you want to interested in the engineering aspects of it, or vice versa, it might be much harder to become a doctor after you have spent 4 or 5 years on a different track. But it's always easy to adjust, pivot, adapt, and you should if something is very revealing to you about yourself. So having said that, I think the key, I would say, that I felt was important for me to survive in the field of medicine was, again, it goes back to you need to have a high degree of compassion to wanting to help someone else, right? But in this case, particularly patients who are suffering, I felt curiosity is very important. Medicine is an area where you're going to be forced to constantly learn, right? There is nothing okay, I finished my master's or this degree, then I never have to touch a book again. Even now I have to certify myself. Every 10 years, the field is constantly evolving. If I don't, study a lot, new content and memorize it, even when I'm 50, I'll become quite irrelevant, and I may not be competitive. So it's that's a very critical component, the ability and the push that you want to really learn new material and synthesize it and see how you want to apply. So the curiosity, the resilience is going to be so important during med school, residency, or further training, because it'll test you physically and mentally. So you really need to have that grit. So it's not a easy way to an end goal. It's a hard way to a very successful path, if that's what you want. And I also think that's the one thing that probably is not consciously taught, but then you learn to be one, is actually being a leader. Because if you can imagine, at the end of the day, the doctor will always be the final person making the decision as to what the best thing for the physician, for the patient, after having all the data. If you're in the ER or in an ICU, if someone is crashing on you, you're the accountable person, right? So you have to know how to lead under undue stressful situation, and you have to be comfortable with that. knowing that the outcome may not be what you desire, and it may not be in your control, or there may be 3 different ways of doing treatments, and you chose what you thought was appropriate, and the team concurred, and you did it, and still didn't get the outcome. And you need to be able to be okay with like failing once in a while. So that leadership quality, I think, is extremely important, because your role inherently is asking you to be a leader under various scenarios. So if you don't want to be in that situation where everybody's looking up to you, then I think it really gets, it could be quite stressful to be a physician in any setting for the matter. And then finally, how well you communicate is important. It's not like you're talking to large audiences all the time or having big meetings. You may be just with the patient and the family, but how well you speak, how well you're able to develop the trust, all that becomes important, because that will also require a lot of patience, because people are going to have a lot of questions. Like, they'll pressure test, like, why you're doing certain things certain way. So you shouldn't get quickly offended. Like, say, like, I'm the doctor, I know what I'm doing. Like, just follow it. But you need to think of it as like, you're developing the relationship with the patient, and how do you get them on board, like, what you think is the right treatment for them. So that means you have to be good at negotiating, communicating, figuring out a way to develop trust. Like, so those are some of the things I think are core, which is kind of applicable to a lot of other fields too. But when you're in front of a patient, like, who's emotionally in distress, like, some of these, like, this compassion, ability to articulate under stress and lead under stress, like, those things become very important.
Mm-hmm. Dr. Swami, I wanted to double click on one thing you talked about. You talked about the situation when you're in the ER and you have to make a decision on something which is very critical. This is something which is quite unique to the medical profession, right? Constantly having to make decisions in sort of life-threatening situations. How does one mentally prepare for something like that? Do you have any specific techniques for this?
Yeah, I mean, that's a great question. And I think the strategies are going to be, or techniques or tactics needs to be very personal to that person, like, and how they handle stress themselves, right? I mean, you and me, like, we may be handling things in different ways. So you need to figure out, like, what works. So the stress is actually, like, it comes in 2 ways, like, particularly when it's like life-threatening and you're in the middle of it, like in the ER or in the ICU. What has worked for me is really learning to recognize patterns, which essentially means you have to be really a good doctor to keep that stress down, or be comfortable in a life or death situation. Because if you don't know what you need to do, or to recognize some things, like, you're going to miss, and you're going to have, like, bad outcomes, and that will only make things worse, because your confidence won't grow, and your stress will continue to creep up, right? And that's like a bad situation to be in. So it's always about pattern recognition, and backing your decisions on knowledge, which means you have to, like, really study all those big books that you're required to study and assimilate. You have to do it. That's the hard part. And so for me, it's always developing a good set of habits. Anticipate things, know the circumstance under which you're practicing. A lot of times, like, you may know everything, but the hospital may not be equipped to deliver certain type of care compared to others. The teams and the resources around you, like, may not be adequate to deliver the best care. Unfortunately, these things do happen. So you have to also have that awareness around, like, where you're delivering care, where you're practicing. And you should be totally comfortable. Easily said than done. I still struggle with it. Is you're going to do the best you can, and you're still going to lose the patient sometimes, or you're not going to get the option. That's the science humbling us to some extent, because we think we know everything, but you will not, and you won't have the data, all the data, to make that kind of a very well thought out decisions. and you're going to lose patients, and that's okay. You need to be able to defend, like, as what we call go through the red face test. If tomorrow you put me on a stand and ask me, like, why did you do what you did, you should be able to, like, articulate very clearly why, right? So having some clarity of thought, the pattern recognition, what is the environment in which you're, like, practicing, those are kind of the mindset and the habits you want to, like, really develop to handle this life or death situation, and recognizing that you're not going to win all the time, and the fallout from that would be, like, how do you handle the family, which obviously is going to be very distraught if something doesn't go right. And this is where the compassion and able to articulate and develop the trust, all that becomes really important. So
just switching tracks a little, we see a lot of Indian kids going to various countries to do medicine. We still have kids going to China, to Germany, to continental Europe, of course, the US, UK. How easy is it to practice medicine in one country if you've studied medicine in another?
So I'll start by saying that the fundamental basics of medicine doesn't change, right? The diabetes, like, in China or in Europe or in US, the pathology is the same. There may be certain intrinsic differences based on the race. For certain diseases, it does happen, right? Asians have a certain reasons and ways, like, that certain diseases develop in them compared to, like, Caucasians or other race people. So you will recognize those and you will learn those to some extent. But how do you treat diabetes? What causes it? Those fundamental, the textbooks pretty much are almost, these days at least, is pretty much the same. So the knowledge base you're building is the same. Where the differences will come is how that care is being delivered, because now it goes into the environment, the regulations, the expectations of the hospital as to how a doctor will work in the hospital. Those are the things that you have to onboard onto. And if you don't have language as an issue, which could be, right? I mean, in Europe and most parts in the Europe and in the US, I think most of the folks from India, like, will, do very well, like, because languages, we may have accents and things like that, but at least at the base level, we'll be able to communicate. But if you go to a very heavily non-English speaking country, I mean, there is that onboarding of, how do you really get onto the local dialect and talk in a way that you're able to get the right information. It could be a challenge. And it's a challenge within India too. Like, I've struggled when I don't know Telugu. Like, a lot of my patients, like, when I was in Madras, they used to come from Andhra Pradesh, and I really had struggled. They have translators, but it makes it just even more harder sometimes to understand. Otherwise, I think, none of those things are insurmountable, is what I want to say. If you're a good physician, all the additional things are things that you will, after becoming a physician and you have gone through the hard training, those things are not, things that you would struggle at all. So I think you will onboard, you'll figure out a way. I've always been very proud to see, like, how adaptable and capable, like, folks in India are from. I think that's how we kind of grow or we get trained. So I think that shouldn't be a concern at all. But there may be requirements as to how to get to practice, right? Licensing, the residency training, the number of duration of years, and the environment in which you need to do all those to get a job may differ based on the country and the regulations. So you have to go through that process. But practicing medicine is not very different. And patients usually are, they're not, at least in the US, when I've been in clinic, I've not seen patients, like, who would, be really worried that, like, you're not from the local country. This again goes back to, like, how you develop the trust, like, how do you speak? Are you asking the right questions? Are you thinking about them primarily in mind? So those things will come into play and you'll still be quite successful.
Dr. Swami, I wanted to switch tack to another thing I observed in your profile. Today, technology plays a very big role, right? 3D,
Yeah.
robotics, artificial intelligence, everything. And you've done a lot of work in technology. So, as a student, you'd specialize in medicine, but today you can't escape technology. So, how should students prepare themselves for this aspect of the medical profession?
Yeah, I mean, I think it's a very important aspect to start thinking about, and because I firmly believe like integrating technology, not just like apps or like new portals and things like that, just even the way you behave and make decisions is going to fundamentally change based on some of the new capabilities that are being tested, right? Particularly when it comes to artificial intelligence, machine learning. I mean, I am sure that to some extent that's evolving back in India too, given the capabilities we have in India from the technology side. But it's becoming, very, very significantly different here. The organizations are constantly getting pushed to take a position as to how we are going to integrate this, like what efficiencies and effectiveness you can get out of these things, right? And you really want to be, to some extent, very loosely put, like you want to foolproof your future. So whether you like it or not, you at least need to be a little bit literate about technology. You don't have to be an expert, obviously. I mean, to the extent or the magnitude you want to train deep in technology is totally a personal decision. So in my case, I really wanted to know how some of these models work. So that's what drove me to pursue more trainings focused on AI and ML. That's what I've been doing, and it's taking a lot of time. But then that also feeds into my needs of constantly learning new things and curiosity. So it works well for me. I just had to figure out how to find the time to do it. With family, work, and this. But I think it's absolutely important. So I would say, compared to maybe 20, 25 years back, like the ability and the access to learning is substantially gone up, right? There are like so many ways you can do all this ancillary training, whether you want to do Coursera or like so many different areas. The education technology platforms are so much. You have even YouTube and so many different portals, right? So just mapping out what are the key minimum things that you want to learn. And I talk to a lot of people in technology, and I say, like, this is where I come from. So don't tell me, like, what a computer science person has to learn the depth, like, what I need to know to, one, at least understand. And if I want to have a conversation in my AI technology company, like, if I want to talk to an engineering person, at least I need to be able to like have 2 clicks down to have that conversation so that I can understand what he or she is saying and they understand what I'm telling them, right? And this is applicable to any interdisciplinary areas, right? I mean, it's always good to, have some of those familiarity, because it also becomes a differentiation, when you're going for a job, and it is going to become a differentiation moving forward, at least in the US. Be it in the research area, technology is being applied. If you're hospital administration, the workflows are getting modified because now you can automate a lot of things in an intelligent fashion. Your machine learnings that are learning what you should be doing, the right thing for the patients. And you need to be comfortable working in an entirely different, architecture coming from the technology side, like moving forward. So it almost is going to become a requirement to some extent over a period of time if all the claims map out to be true, right? There is always that hype cycle that happens. But I think there are meaningful things that will come through, and it's already happened here. That if you're used to a certain way, you may not be able to like resist from not doing it that way, because you'll be required to do it that way. And if you want to be in leadership roles to really innovate and move organization in a certain way, you really need to have that additional skills that that you stand out and like you can influence people, because folks who are working in an organization will also think like, are you the right person to like really lead that charge? So if I have an AI technology company and if I can't spell what artificial intelligence is, like that's not a good look, right? So it's also that practical considerations. So, and this is just not, again, technology. Again, like if you're into business or into like law or whatever it is, like certain flavors that's tangentially related to medicine that you're interested in, I think I personally believe like you should be able to have like at least 1 or 2 clicks into that area to be quite competitive.
So just a related question. So we keep hearing the phrase engineering is the new medicine. And a lot of kids we know are looking at bioengineering as a field. So what would you say as its potential, and do you see this growing? Is it a good choice to make?
Absolutely yes. And I think it's always been, even when I was in med school, I had uh, certain conversations with professors, where, in my opinion, where years ahead of, where, they were practicing, in the early 90s. The engineering and medicine always intersects, right? We have so many devices, there is so much equipments, be a scanner or, I'm talking about on the hardware side, right? First, the software and the integration has always been there, and we just talked about it. It's only going to be more, right? But the new ways of either making stents or prosthetics, for specific areas, equipments the microscopes, or sequence, like gene sequencing readers, and there's always that constant interface between biology and medicine. And as the capability on the engineering side, the hardware side, is going to continue to improve, and as our understanding of biology and what is really needed is going to go up, it's inevitable that these two specialties will only continue to grow. Having said that, there's always a little bit more interest, or at least the way I see it, there is more excitement around this software biology interface compared to the hardware, even though the hardware is what's truly driving success to some extent. We have better scanners now before we had before. We have newer technologies of delivering radiation to precisely, treat certain type of cancers. We have new radiation, like the physics around radiation, that physicists and biologists are working together to figure out what type to use, right? And a lot of times, these things are happening in the background. You don't hear so much in the news as much as you hear about the health tech, the artificial intelligence side of things. But that's a sure shot. And that's also, again, as I mentioned, if I was a physician and I was interested in all things, engineering, how do I engineer, to study a certain disease? I think it's a very, very strong, robust area and a foolproof area to be in. For example, I worked in a very small company. The co-founders were all engineers from Intel. They had capable. Their talent was all about microfluidics. So they created a table and desktop-sized, printer-sized device that manufactured a drug under what we call GMP capability. It's pretty phenomenal. It's such a small box, but it makes a very complex platform mRNA-based drug. It had multiple cameras inside. It captures every step in the process so that you can do quality control. It was unthinkable, that you could do something like that. But the idea actually came from someone who had no biology background, but they had the engineering capability. They had an interface with the biologist, and they developed this, which was pretty cool, right? And if it was not, if I had both the capabilities or interest in both, you could come up with these really exceptionally cool ideas, and develop it. So, bioengineers or physician engineers are always a very exciting area in my mind. Just something that I haven't personally gone into. I've gone more into the software side of things a little bit. Yeah.
Dr. Swami, we learned a lot about the medical profession today. Before we leave you, I'd like to ask you one last question. What would you say is cool about your profession?
Yeah, so I would broadly put it this way. The coolest thing is I still feel very closely connected to what my core guiding principle was like, when I kind of went into medicine, I'm not in the stage, right? I'm behind the scenes right now. And that's okay. That's a personal decision I made. Not to be a physician delivering care, but helping patients from maybe 3 or 4 layers behind. But I think I am able to still make a significant difference in patients' life. I'm continuing to learn new things and grow. And the way I've mapped out my work is it's helping a lot of time for me to spend time with my family. That I would say, spending time with the family, I would say, is the coolest thing that I've been able to map out with my career. A lot of times for physicians, it gets harder if you're a practicing doctor. So I just feel like it's balanced, it's purposeful. But if I think back on some of the cooler things I've done is, I was part of 3 medications, the drugs, that has been exceptionally, effective for patients for 3 different type of cancers. So I supported 2 of those approvals, and I led one of those. So I'm not the one using the drug in the clinic and seeing the difference, but just knowing that you had a role to play, where globally, a lot of those patients are hopefully getting benefit is what I think was the coolest thing. And then moving forward, what I think will be cool is figuring out how these. I have 2 different companies. One is a consulting company where I consult as a physician for organizations to help with the drug development. The other one is the AI technology company that I'm working with the engineering team and really excited to see where it goes. So there's just not one cool thing. I have a few cool things I'm juggling around. I'm quite happy at this stage.
Thanks, Dr. Swami. Thank you for joining our show.
Sure. Thank you so much. Very thoughtful responses. I'm sure they'll help a lot of students. Thank you.
I hope so.
Thank you.
Bye-bye.
Bye.
Before we go, let's quickly stock up on our decision-making tools. Today, we'll talk about confirmation bias. A confirmation bias happens when we process new information through the filter of our existing beliefs. We may pay more attention to what confirms what we already believe in and ignore anything that goes against it. Let's say, for instance, you're sold on a certain college because your friends are going there. And they tell you that it's great fun. It might be a great choice, and it might not be. What could happen is that you ignore data and hard facts about other good colleges because you absorb only information that confirms what you want to believe. That is, the first college is the place for you. That's confirmation bias. So how do we overcome confirmation bias while making a decision? The only way to do that is to actively seek out information that contradicts what you believe in. Once you've done your research on both sides of the argument, you'll arrive at a more balanced view. That's how we can overcome confirmation bias. I hope today's episode was useful for you. That's all we have today, and see you in the next profession. Bye.
Bye.